Okay, let's unpack this. We're taking a deep dive today into something, well, pretty intriguing and complex. Healthcare and medical tourism in China, especially looking at it from the perspective of international patients. You shared some fascinating sources. I mean, everything from dense legal analyses to really personal stories, anecdotes, and even academic studies looking at patient satisfaction.
Right.
So our mission here is to sort of pull out the crucial insights from all this, help you navigate this quite intricate world, and maybe understand why it's not quite as straightforward as it might seem.
Yeah, and what's truly fascinating, I think, is just how wildly different experiences can be. It really depends on where you are in China and, frankly, who you are.
Oh, interesting.
So we'll explore the unique challenges, but also the opportunities that pop up when healthcare goes global. We'll focus on what's absolutely essential for you to know if you're thinking about seeking medical care or, engaging in medical tourism there.
Okay, so let's start with maybe the perception, the best foot forward picture of China's healthcare. Our sources definitely confirm that some hospitals, especially in those big tier 1 cities like Beijing, Shanghai, they genuinely offer superb, top-level care.
They really do. We're talking modern equipment, English-speaking staff, particularly in dedicated VIP wings.
Right, the VIP wings.
And some experts even argue this care can rival, maybe even exceed, what you might find in other major international cities.
That sounds incredibly promising, almost like a medical paradise in those specific spots.
Indeed. That's let's call it the shiny facade. But here's where it gets really interesting and maybe a bit more complicated.
Okay.
This really positive experience, it just doesn't extend to the vast majority of China.
Okay.
We've seen personal accounts that reveal a stark, sometimes quite unsettling contrast once you get outside those major hubs. Well, imagine being in severe pain, only to find that basic pain relief is hard to come by. Or facing just endless, unexplained tests that feel less about diagnosis and more about, milking funds. It can leave patients feeling really vulnerable, desperate even.
Wow.
And the startling insight here, the number that really jumps out, is that this world-class experience, it represents maybe only about 5% of China's overall population.
Only 5%.
Yeah, given China's huge population, 1.4 billion people, that means the vast, vast majority face a very different healthcare reality. It's a stark reminder that scale really matters when we talk about access.
That 5% figure is, quite sobering. But thinking about international patients, wherever they might go, there are certain universal demands, aren't there? Things they look for.
Absolutely. They naturally prioritize strong privacy things like single consultation rooms. Effective communication is huge, so that means multilingual staff, medical records in English. And multicultural sensitivity is key too. Maybe female doctors available, prayer spaces, Western-style amenities, and of course the basics. A pleasant, clean environment plus qualified professional care with processes that actually work efficiently. These are pretty much non-negotiable.
Right, non-negotiables for the patient.
Oh, precisely.
But this raises that crucial, maybe often overlooked question. What happens when things don't go to plan? When expectations clash with reality, especially when legal issues come up?
That's the critical point. From a legal perspective, medical tourism in China carries, significant risks. For instance, there are regulatory gaps. There isn't always a specific accreditation standard just for medical tourism institutions. We also see issues sometimes with administrative oversight. Think about some past cases involving illegal vaccinations, or maybe more famously, the gene-edited babies case.
Right, I remember that.
Yeah, where really cutting-edge, unprecedented procedures happen before clear ethical and legal guidelines were even properly established. The law lags behind the science sometimes.
And I imagine if something does go wrong during enlightenment, the legal path for a patient, especially an international one, can be incredibly difficult.
Absolutely. Very challenging. Civil liability risks are a major factor. Tour operators, for example, often use these exemption clauses in contracts to try and limit their responsibility. And the medical providers themselves might argue privity of contract, basically saying their legal agreement is only directly with you, the patient, not with the tour operator or anyone else. This makes it incredibly difficult to hold the whole chain accountable.
So you're kind of stuck in the middle.
Exactly. And pursuing legal action itself is just fraught with hurdles. You've got jurisdiction clauses that often favor the provider's location, the sheer difficulty of getting a judgment enforced across international borders, maybe even issues of immunity. It can leave patients feeling like they have very little real recourse.
Okay, so knowing all this, these risks, these contrasts, What steps can you, the listener, take to navigate this more safely? Or, what's being done systemically to maybe improve the situation?
Well, improving the landscape involves several strategies. There's definitely a push for more unified international accreditation for these medical tourism places, something like DNV certification, which is a recognized global standard that signals quality and safety.
Okay, like a seal of approval.
Sort of, yeah. Digitalization is also key, just getting better information out there more easily, and building more comprehensive service chains, making sure the whole journey is smoother.
What does that involve?
Things like better language training for medical staff, that's crucial. Fostering more general practitioners, family doctor types, and even attracting foreign medical experts to come and work in China to help boost those international medical services.
Right. So pulling all these threads together, it seems our deep dive reveals a really nuanced picture. You've got these pockets of genuine excellence, often geared towards international patients in big cities, but also a rapidly evolving legal framework that's kind of grappling with new challenges. And this really stark contrast in quality and access across different regions.
Exactly. And if we connect this to the bigger picture, it really highlights this global trend of medical travel, doesn't it? But it also underlines the absolute need for clear, unified standards and really robust patient protections everywhere, not just in one country.
So for you, the listener.
Yeah, for you, it means being informed about the specifics, understand where those top-tier services are concentrated, and be acutely aware of how critical that legal and cultural due diligence is before you consider medical care abroad anywhere.
So here's something to think about. As healthcare becomes more and more globalized, how can individuals, how can you truly ensure your safety and rights when you cross borders for treatment? And maybe, what responsibility do the destination countries themselves have to unify those quality standards across all their diverse regions so no patient gets left behind or feels vulnerable? Something to mull over until our next deep dive.